I'm Reverend Jeannette Phillips, and I have something to say. In our community, Peekskill is in the northern tier of Westchester County. And the Westchester, now it's Westchester Medical Center, but in years back, it was Grasslands Hospital. And that's where many of us had to travel to go for clinical care, primary care. And it was a 2-hour bus ride from Peekskill to Grasslands. And Mary Woods, one of the founding mothers and certainly a former co-worker of mine at the Veterans Hospital, said that she took the bus with 3 of her children and in traveling to the hospital, received services, and it was late in the evening and she missed the connecting bus. So there she was with her children, chilly out there at the bus stop. The kids are hungry. And she had to wait until she could find someone in Peekskill that could come and pick her up. So the next day, she went over to the CAP office and had spoke with some of the other ladies that she knew and said what an ordeal she had gone through and that surely we could do better than that within our community. So that struck a chord. And from that, the community action program took a survey in the community. And I know because someone knocked on my door and I filled out the survey form. And the survey form had information regarding healthcare, housing, jobs, and the school systems. Much of what is the same as we see today in many of our communities. So it was taking that information and calling for a meeting in the city of Peekskill, which was held at the United Methodist Church. And that meeting, Willie Mae Jackson, because she was a mother of 12, so we said, well, we know you got voice, so you're going to be able to share this story. And she did. And it was at that meeting that the community members, near 200 people, and for a community our size, for that many people to come out to hear what the concerns were about healthcare. You had people from the community hospital, from the Grasslands Hospital. You had people from the health department, senior citizens, people from our faith community. It was just a total, real mix of community coming together to say, what can we do? So 2 months later in January, the second meeting was held at the Presbyterian Church in Peekskill, which was about a block and a half from my house. So as I was walking there, to attend the meeting, I had thought about John F. Kennedy's speech, in his inaugural speech, when he said, "Ask not what your country can do for you, but what you can do together for your country." And so I kind of felt like I had my marching orders as I was going to the church. So I got there and the meeting was held upstairs, and that's just another play on words, going to the church and in the upper room, that a little over 100 people were gathered. And one African-American woman that I knew well, was part of the community action program, came over to me on the side and said, "Jeannette, if we nominate you, would you be willing for us to nominate you to become chairperson?" And I looked around the room and maybe there were about 10 or 12 Blacks out of this entire group there. And I said, "Yeah, sure, right." I didn't see that coming. And so I was elected chairwoman pro tem. So that got the ball moving for us to be able to say that healthcare really is a right for all people and not just a privilege for some. Well, I can attest that in my family, my husband and I were working at the Veterans Hospital and had insurance, but a large family. So your premium, we couldn't afford a high premium payment. So we had what was called a low tier in terms of insurance, which meant it was almost like no insurance because the different doctors in the community didn't accept it because it didn't pay enough. They didn't take Medicare, they didn't take Medicaid. And if you were what they used to use the term as indigent, then you had to use whatever public health services would be available. I knew what it was to go to the basement of City Hall and have obstetrical care. Glad to have an opportunity for care. But for the exam rooms, the only thing that separated one exam table from another was a sheet of exam paper from the exam paper. I mean, the dehumanizing impact of that. And if you have a child or two with you, because wherever you go, would go, you've got to carry your kids or so. And there you are. I mean, that was such an impact to me that I said, surely we can do better than this. To the Office of Economic Opportunity, one of the last anti-poverty programs. So it was with that pot of money that we were able to look for a place in Peekskill and to actually then, from 1971's first meeting until 1975, in terms of actually opening our doors. And during that time, there was a lot of community involvement. Our meetings would be 50, 60 people just in attendance to see exactly what was going on and what we were doing, and if we were capable, if you will, of doing it. Because we had, I mean, we have to just really be clear that racially speaking, to speak about opening up a business in the core of downtown did not set and meet well with people of the business community or other people in general, in terms of saying, you're bringing these people into our town, into our downtown. And so the scrutiny was there to keep on top of what was going on. And it afforded us the opportunity to connect with those who would help in addition to the board. So that was a bit of the rockiness in the beginning. And I can tell you over a 47-year period of time, we had struggles at every level. And that was true for community health centers across the nation. We were an entity and now a force to deal with because we have advocated year in and year out for the right for people to have health care. And then once we got the letter from the Office of Economic Opportunity for $285,000, which was to be over a 3-year period, to open our doors. It didn't have anything else, a line item other than getting the physical plant and being able to open our doors. President Nixon, during his administration, he put a freeze across the nation on the various discretionary programs. And we had what was called National Mobilization Day across this country and did a march and came to the Capitol. That was my first experience of going to Washington, D.C. And from Peekskill, we had a school bus in Elmsford, which is just about 15 miles or so out from Peekskill. And so through the community action program, we got people to ride with us to Washington, D.C. And I say to people all the time, if you can get a man, my husband, to leave his car and get on the school bus to go to Washington, you're doing something. And so he came along to certainly give us support in our endeavor. And the school bus driver got lost in terms of where the school bus could go on the road. So it ended up from a 4-hour ride to being a 9-hour ride into Washington. We got there 2 or 3 o'clock in the morning. Anyway, that morning, going to the Capitol to make our case, I recall walking those steps of the Capitol building, a beautiful blue sky. And I tell you, it was such an experience for me. I will never forget mounting those steps to being able to say, I was going there to share in our story, that this mobilization day was real and people were coming from all over the country. And sure enough, what happened, I said, as community people, we also knew when we needed to have lawyers to do their part. And so a class action suit was filed against the federal government. And of course, those funds across were released. There were funds for daycare, for community action programs, for lunch programs, and our own healthcare programs. So we were all affected, but we were successful in having those funds released back to us. So then we could continue in Peekskill to work on being able to see what we could do. And one of our board members, aunt, owned the building. It was formerly a department store, Big Scott's, if you will. And we were able to rent that portion of the building. And the other side of the building, a paint store owned, and it was a 1-block piece of property. And so that's where we were when we opened our doors. We were able to do the renovations from the department store to make exam rooms and waiting areas, labs, and so forth. So we had all of that, but we had no money to pay for any staff or do anything else. But we were still so excited because we had a place for people to come. It was our place. It was our hard work and our efforts to, again, bring to the realization that our families were going to be treated here in Peekskill, all of our families. And that's the beauty of community. While it was for African American women that we stood fast the test of time, but it was for all of us, because we did have that kind of integration, that kind of togetherness of the people that did come and became members of that board, that really put us in the position that we could be in, because we needed one another. In that beginning period, it was a very delicate balance in the community as we were looking to bring this entity in, from the medical societies there, as well as the community. Dr. Phyllis Coteen had an intern working in her office, Ann Kaufman Nolan, and she thought that I should speak with her and see what her interests would be. And so sure enough, Ann and I met at one of our fundraisers for the health center. And we immediately knew that we had the same goals and ambitions in mind about healthcare. She had the roots, if you will, of being able to know how you need to come together, pull together, and work together, and not be afraid of work at all. So, coming from a farm, you're not afraid of any work. With Ann coming on as our president and CEO for these last 45 years. This year marks 45 years for both of us being on staff. It is under her leadership and the board's leadership that we have been able to go from one site in Peekskill to now these 43 sites. We're in 3 regions. We're in the Hudson Valley, from as far north as Hudson, New York, which is just a half hour out from Albany, on both sides of the Hudson, coming down into New York City, all 5 boroughs, and Staten Island, and into Suffolk County, as far out as Riverhead. And so that's been that is a journey. And a movement, and I like the word movement and journey. It lets us know that it is still in process. And today, if I may just get ahead of myself in a sense, today when we speak in terms of Black Lives Matter, Black, Brown, Asian matter, that we have to go more than the extra mile, but we must make that journey together. We must move together. And that's why this is so critical for us. And the development has not been as a for-profit enterprise that is just, taking up all of the different sites to put their business up. It's because of community need. And the community of need reach back out to us. And having a board that 51% is users of the services, that's a federal mandate, because they know better and best as to what's going on in a community health center. In the community that we're in, there was that divide that I had to make sure I was being able to communicate with the political arena and the interfaith arena, and then the community in and of itself, of our everyday folk, as of to who we are. And then to walk those lines when our first 2 directors, one Black, which was an extremely difficult time for the community rising up, the Black community rising up in the ranks to say, we're standing firm and we're standing together to bring healthcare to fruition in our community and letting our voices be heard. And then to have a director who could not meet that challenge of our community. So those were very frustrating moments. And this was work every day. And the benefit that I had was the fact of being self-employed during that particular time. It gave me the time to have meetings, to go places and so forth. And Dr. Phyllis Coteen and Harriet Gelfand, who mentored me through that part of the process, said, Jeannette, you've got to be at every meeting. And I would say, but I'm there, and these people are far more educated than myself. They have a lot more experience than me, and I'm lost. And they said, but you've got to be there. And I took to heart what Shirley Chisholm said about not only being in the room, but being at the table. And if they don't have a chair for you at the table, bring your own. And so I did that. And many times at many meetings, and especially when we were dealing with the medical providers from the hospitals and from nursing homes, from the schools of medicine that would be in a room. And I might be the only Black, and especially the only Black woman, where no one engaged that much in any conversation with me, but I was there. And the importance of being there, I signed in Jeannette Phillips, Peekskill Area Health Center, Community Health Center. It kept our names and our on the pages of history, if you will, to say community health centers were there at the table. Doesn't have to say whether you spoke or not, but you were there. And it was that kind of consistency that continued forward to bring us to really where we are today, really being felt and being known for the work that community health centers do. We've been fortunate to have excellent staffers that are committed. We have a program that we are now an affiliate, an associate organization of Plaintree, which is called Patient-Centered Care. And we deal in that daily. And that presents the environment of healing, but also the environment of the person. It's person-centered care. And that's part of what in our whole movement and journey was to give the respect that all people deserve in the quality of care that is delivered. And so being able to have an organization of this size, you still have to have that human touch of dignity as you go forward in being able to render the care that is needed. We need definitely, no question about the quality, but how it's delivered is very important. It never loses my mind in terms of the basement at City Hall or traveling 2 hours to get health care and not know if you're going to be able to, how you're going to get back home and caring for your children. And they're exposed and seeing all of this too. The impact of all of those things and the social determinants of health are there. And being a community health center, we foster those relationships so that we can get through. We knew those things were happening before they began to finally legislatively say, oh, people need to have housing. Oh, people need to have better jobs. People need to be able to know that healthcare is available to them right here in their community, and that they're not going to be turned away because of inability to pay. You know, those kind of things that come forward that we have to continue today to work on. Being legislatively in tune, we have a National Association for Community Health Centers office in Washington, D.C. that prepares those position papers that we can present fact, not fake news, if you will, to our legislative bodies so they can do the work for us that we elect them to do. And in our advocacy, we stay very strong about being able to keep our legislative bodies informed on the federal level as well as on the state level. So these are the different things that are before us now. The cost of healthcare and the quality of healthcare You have to have administrators today that have to be on point about all of these things, because it always comes back to the who will pay. You know, we tease and say there's no free lunch, okay, and there's no free clinic. Somebody's going to pay somewhere along the line, but it is because of our advocacy and letting our voices be heard that we're able to share with them not only what we need, but how we can help go about to do it, that we're there. And that was the other piece that the founding mothers that we had in our hearts, that we weren't there asking for someone to give us anything. We were there to be able to say, how can we work together for the benefit of our entire community? We're just standing up. It is our true grit that has us here in the forefront, but it is for all of us, and those are just very key and strong, not only words but actions that we have to see take place. This is another important time for us, and I guess historians will say, everyone will say this period was this or this period was that. But we are in and still in a pandemic stage in this country, and it has brought us to recognize how much more we need one another. The isolation and the impact of what has happened to our families and the deaths and the being able to be at one's bedside or not being able to be at one bedside, it has brought out a more humanistic viewpoint of what life really is. And being able to help people, and especially people of color. And President Biden acknowledged that in the sense when he said community health centers have far exceeded any other body of being able to get people vaccinated and into care. And that's precisely what we had been saying all along, that we have the pulse of our community because we are in the community. And so in this particular point in time, the fact that I said earlier about Black Lives Mattering and what we have seen of the coming together of people globally addressing the various killings and the issues and all of that. So it's an important time for us, and healthcare is in the midst of that because it's part of the civil rights and human rights issues that have been addressed down through the years. But in this particular set and time, we're able to, in all of our legislative attempts, to continue to move things forward. We have to, in that, not only just say Black lives or brown lives or Asian lives or white lives matter, is what you begin to do about it. And being able to grasp what undoing racism really is all about, it means we have to come together. We have to look through the lens of what happened many, many years ago in this country and being able to walk through together to say how we can make it better. And so healthcare is in the midst of all of that, because a healthier family is a healthier community and a healthier nation. And so, so that's the challenge in the forefront, because we have raising the dollars to pay for the healthcare, but we've also got to make sure that the quality will take away, the quality will give us better and longer life, if you will, for people that have been neglected in the system by false information, by research information, and all of the things that unfortunately had been foisted on people years back, to be able to say today, some of that still exists, but it's in a different way. You don't hear it like in a Frankenstein lab, if you will. But yet, when we have people of color dying of particular diseases because they weren't treated early enough, because some didn't get the right exams, because they weren't paying attention of what might be more prone in an African American or in an Asian or in a Hispanic, because it just was glossed over in some respects. So I mean, I could kind of go on with that, but that's it in a nutshell. So for right now, it's all very much present in our organizations. And as Sun River Health, we have taken on the undoing racism very seriously in our organization, and have instituted what we call JEDI, almost taking us to Star Wars or something, but it's justice, equity, diversity, and inclusion. And you've got to work all of that in order to really get at the core of having a society that is together, and a healthy society for all of us. I think January 6th showed us a picture that most of us would have never thought we would have seen in this country in this day and time. And I think that when we look at the JEDI of justice, equality, diversity, and inclusion as a community and as a family, because things start at home around our own table, and begin to process where we really are in this country and in our family, in our community, in our churches, in our synagogues, in our mosques, all of the interfaith bodies, that we need to begin to challenge ourselves to say, how do we make it better? There's many things from within our communities that we can work on to be able to say, yes, lives matter. And I'm going to do what I can to help make that difference. I'm going to look at myself, my thoughts, my ways, and see how I can help make a difference. Am I using the proper lens, if you will, to look at situations that could be improved? Am I sharing in the schools? Am I sharing in the churches, in the office, in even the corporate world, and not just to put some money at something, but invest yourself. Invest yourself in what it is that you're doing, because you have that real, genuine feel for wanting to make change. And just knowing, giving your own heartfelt answers to some of the questions that may come your way in terms of making things better, to know that we can do it together. And so the key word I would say, yes, we can, and let's do it.